imagine you're walking through a field one day, and as you're walking, all of a sudden you see a lion pop out of nowhere. So if you attended my class on autonomic nervous system, you know that I usually started off with a story. And I think 1 or 2 batches in GMC have already been in my class in autonomic nervous system. So here's a little story. We'll start off with this, right? This will help you understand a lot of basic things, because people get confused over silly things. When you talk about autonomic nervous system, you modify the question in such a way that it's vasoconstriction, vasodilation, things like that. People get very confused. I don't know why, because it's a very simple concept. You never have to ever get confused with it, right? Listen to the story, keep it in your mind, right? Whenever a question comes, you just have to think about the story, and I assure you'll never get confused with these basic things, right? We'll start off. Yeah, so you're the protagonist of the story, right? You are walking, right? So imagine you're walking through a field one day, and as you're walking, all of a sudden you see a lion pop out of nowhere. So you're standing here and you see a lion over here, right? What are you going to do? A really dumb person would try to fight it with no weapon in hand, right? So considering you're not an idiot, we'll think of the next alternative: fight or flight, right? So I would run, right? There's no way I would try to fight a lion with my body, definitely, right? So I see a lion, I'm walking, I see a lion. What am I going to do? I'm going to run for my life, right? Right? Okay. So I see the lion, I'm running for my life. I don't know where I'm going. I head through the woods, right? So I'm running for my life, I'm heading through the woods into some unknown territory, right? Imagine this is Andaman Nicobar Island. There's some tribal people over there who have not yet been discovered, right? They're very hostile. So I wander off towards the edge of those land, right? So I'm running for my life. Now you tell me, what should happen to me? I'm running for my life, right? Metabolic systems in our body is very active, right? There are a lot of exothermic reactions happening, right? Do I need to sweat to release all the heat? Yes. So I need to be sweating, right? Okay. I'm running for my life. Do I need to breathe more? Should there be more ventilation? Should more air passage take place? Yes. So what should happen to my bronchial ways, airways? Should it dilate or should it constrict? I need more air. I'm running for my life. I need more air, right? I don't want to be wheezing in between when I'm running for my life, right? So should it bronchoconstrict or should it dilate? It should dilate, right? I'm running for my life, right? Temperature regulation, sweating should take place, right? Bronchodilation should take place, right? What next? Your body needs blood, your body needs oxygen, right? RBC should traverse through it. So for that, your heart should increase its efficiency, right? It should pump more. It should increase its heart rate. It should increase its stroke volume, right? So heart rate increases, and along with it, the amount of blood pumped also increases. So heart rate into stroke volume would make it your cardiac output, right? Your cardiac output should increase. So heart rate increases, stroke volume increases, right? Okay. So there are a few other things in the heart. We'll come to that a little later, right? So I'm running for my life. Heart rate should increase, right? Stroke volume should increase, cardiac output should increase, bronchodilation should take place, right? And temperature regulation should take place, right? Okay. Now, when I'm running for my life, our body should kind of prioritize, right? It should kind of prioritize which organs blood goes to, right? In this emergency situation, you don't need blood all over GIT and everything, right? You need it for few major components. So which is the most important component where blood should go, oxygen should go, glucose should go at the brain, because it can't survive without glucose. More than 3 minutes it can't survive, right? So blood gets shunted to major organs, right? Heart and the brain, right? So what should happen for that? Peripheral vasoconstriction. Peripheral vasoconstriction. So vasoconstriction here, vasoconstriction here, vasoconstriction here, vasoconstriction here would make the blood get pulled to the core, right? So that your major organs get blood. That's another reason for vasoconstriction. You're running for your life, right? You're running for your life, you're going through woods, you get injured, right? You brush off here and there, you get injured, and maybe you get punctured with a thorn here and there, right? Do you want to bleed to death right now? You know you're running for your life, you know some immediate danger is going to happen, you need to minimize the amount of bleeding that is there. Again, peripheral vasoconstriction would prevent the amount of bleeding that is happening, right? Right. So peripheral vasoconstriction to pull the blood to critical organs, also to prevent bleeding in circumstances, right? So far we've seen that your heart rate increases, stroke volume increases, right? There is bronchodilation, right? Then also there is peripheral vasoconstriction. Now, apart from this, what else happens? You're running for your life, right? And you need to see properly. Your field of vision should improve, right? You're running for your life. Those fibers I had mentioned earlier, all of a sudden they come out and start using arrows on you, right? You need to be able to see the arrows coming. You need to be able to see them from the periphery of your vision, and also keep a note on the line that is almost reaching up to you. So what do you do next? You need to duck and dive and see everything properly. You see an arrow coming like this, and you have to move, right? So for that, you need better vision, right? So you tell me, what should happen to the pupil? Should it go inside or should it come outside, right? Constrictor pupil should be acting or dilator pupil should be acting, right? So it should dilate. So obviously the dilator pupil is going to act right now. Understood? Right. So your dilator pupil is acting, right? You understood these few basic things, right? The remaining part, you're running for your life, right? This is the right time to pee. What about other secretions, gastric secretions? So you're running for your life. Imagine that while you're running, right, all the secretions from your nose and all the salivary secretion keep dripping sideways, right? You're peeing at the same time, you're defecating at the same time. Is this the right time to do all these things? No, you wouldn't want that, right? So take a bladder, right? In the bladder, do you want the bladder muscles to constrict or relax? You'd want the bladder muscles to relax and the sphincters to constrict to make sure that it doesn't go out. Understood? If the bladder muscles are constricted, means evacuation happens, and if the sphincters are relaxed, evacuation happens. So you want the exact opposite of that right now, right? So bladder muscle should relax, sphincters should constrict to prevent evacuation. Same thing happens whether it is defecation or urination. The same principle happens, right? Salivary secretion, do you want it to increase? No, you want it to decrease, right? So it becomes very thick. Hey, you don't want watery discharge at this point, right? So that is about the secretions. Do you want peristalsis to take place? You're running for your life and is starting to increase its peristalsis. Do you want that right now? No, right? So that again is another issue. So all these things are regulated by the sympathetic system. So the peristaltic activity is decreased, motility is decreased, right? Gastric secretions are decreased, right? And the sphincters are constricted by the others are relaxed. Muscles are relaxed. The smooth muscles are relaxed, right? Peripheral vasoconstriction takes place. Heart rate increases, stroke volume increases, cardiac output increases, bronchodilation takes place, and your dilator pupil is constricted. So dilator pupil constricted means it will be mydriasis, right? Okay. So now again we'll come to the next thing, right? You're running for your life, right? You see this very hot girl over there, right? Next to a tree over there, you see this really hot girl. Or if you're a girl, you see a really hot guy with his abs coming out like this, right? Is this the right time to stop and be like, hey? No, right? There's a lion right behind you. You wouldn't care a damn about that person, right? So, is this the right time to actually get an erection? No, right? So you have to keep running. You have to make sure that you survive. That is your sympathetic system, right? So no erection, sexual arousal is not there. You run for your life right now, right? So this is all you have to actually think about. You never have to get confused about these basic things. Just think about the normal physiology, how things are happening, and you'll never have to get confused about these basic things. Right? So this is your sympathetic system, the flight or fight. Right? Okay. So apart from this, the opposite is the parasympathetic system. So that is activated when you're relaxed, you're at home, right? You're at home, you put music on, you put the air conditioning on, right? You're relaxing, right? Most often you'll be looking at something nearby, some near object, and reading or something like that. Would you want a wide field of vision? No. Right? Best time to digest, peristalsis, gastric secretion, to eat, right? This is the time you eat, right? Again, you're sitting at home, nothing else to do. That is when you get sexually aroused, right? Do you want bronchodilation right now? No particular need for that, right? You want your heart rate to keep rising and increase your workload simply, right? So you have no need to put greater work on your heart rate now, right? So this is the exact opposite. You just have to think of the exact opposite in parasympathetic system. Alright? Right. So now that you understood this basic, the next thing is to understand a few concepts about why it's happening like this. Right? And for that, you need to understand a few things about signal transduction in physiology. That again is the next underrated topic in physiology. Right? It's very underappreciated. I feel physiology classes should start with that one topic. Right? So that is why after ECG, my next YouTube channel, in my YouTube channel, the next video is going to be about signal transduction. Right? So because you will need to understand at least the G protein coupled receptors for this topic. Right? I think tomorrow I'll post a video about G protein coupled receptors. Just that. Enough for you to understand these questions, right? So that will help you understand about the alpha, why alpha is acting like that in that part of the body, why beta is acting like this in this part of the body, why beta 1 and beta 2 are different, right? It's all based on their location and what type of receptor they're acting and all that, right? And that is also very simple. I used to get very confused when I was a undergrad, right? But once you understand these few basic principles, it'll be very simple. You'll never forget it in your life, right? So next up, we'll try to understand that, right, in the next episode, that is tomorrow, right? So before that, today's episode, we'll try to go through a few other questions, right, about the center of sympathetic parasympathetic system, the pre-ganglionic, post-ganglionic segments, right, and things at the ganglion. So these were a few questions that have been asked from this system, right, and also the different receptors and how they act in different areas, right? So you got this concept, you had this understanding, right? So we'll go to the next segment right now. One set is about the pre-ganglionic, post-ganglionic fibers, right? So in order to understand that, what you have to see is that in our motor system, say take our motor system, right? So when we take the spinal cord, right, we have the dorsal horn over here, right? So these are the grey matter which are present, right? The grey matter with cell bodies, right? And beyond them there are white matter here. So they are the fibers which are being carried out up and down and all that. So these are the fibers which are there beyond that, outside this, right? So the fibers are here, these are the grey matter. So in the grey matter, in the ventral part, there are group of cells, right? So these are the alpha motor neurons. These alpha motor neurons will go, right, and it will finally go to a muscle, right. So this is an alpha motor neuron which is going to go to its effector organ, right. So we have a alpha motor neuron which is going to its effector organ, right, and this is further under control by higher centers. So from top, this neuron can be controlled, right. So this is what is called a lower motor neuron, right. From the lower motor neuron, that is the neuron, and anyway in its path, this is the lower motor neuron, and that is under control by an upper motor neuron, right. So this is how it is there in your somatic system, in the skeletal system, right, for motor activity, right. So when we come to your autonomic nervous system, right, most often the cell bodies are present here, the pre-ganglionic cell bodies. So it is kind of different from this in the fact that there will be a ganglion in between before reaching the effector. Alright, so this intermediolateral horn, right, the IML, the intermediolateral horn, has cell bodies. So this is a pre-ganglionic neuron, and that goes, right, and it does not directly reach the effector. What it does is, there will be a ganglion present somewhere, right, and in that ganglion there will be another set of neuron, right. So what is ganglion? Accumulation of cell bodies in the periphery. A nucleus is accumulation of cell bodies in the central nervous system, right. So a ganglion which is there in the periphery, and from there the post-ganglion fibers will be there, and that will now go to the effector, right. So what did we understand so far? This is your motor system, right. This is the somatic system, right, and this is your autonomous system, right. So this is the autonomic system where there is a ganglion which is present, and we have pre-ganglionic and we have post-ganglionic fibers which are present, right, and that finally reaches the effector. Now one set of question would be about the nature of the pre-ganglionic and post-ganglionic fibers, right. For that you have to understand that the pre-ganglionic fibers, they are myelinated. So they are myelinated B-type fiber according to Erlanger-Gasser classification, right. So they are myelinated B-type according to Erlanger-Gasser classification, right. What about the post-ganglionic? Post-ganglionic are unmyelinated. They are unmyelinated and they are C-type fibers, right. So the pre-ganglionic are myelinated B-type, post-ganglionic are unmyelinated C-type fibers, right. So a lot of questions can be asked with this interchanged, right. One question could be unmyelinated B-type, another would be myelinated B-type, another would be myelinated C-type, unmyelinated C-type. So it can get very confusing. So it's very simple, right. Pre-ganglionic is myelinated, post-ganglionic is unmyelinated. Pre-ganglionic is B-type, post-ganglionic is C-type. So the next thing is to differentiate between the sympathetic and the parasympathetic nervous system, right. So let's just say it's starting in the intermediolateral horn of the spinal cord, right. The pre-ganglionic fibers are starting over here, okay. Now we have a effector organ over here, right. It could be a gland, it could be a smooth muscle. So this is your effector muscle, right. So what happens now is, we'll have to know the difference between the sympathetic system and the parasympathetic system, right. So first we'll come to parasympathetic system. In parasympathetic system, what you have to know is that the pre-ganglionic fibers which are coming from here, right? So they finally reach a ganglion, but in parasympathetic nervous system, the ganglion are always located close to the effector organ. So it's somewhere over here. So this is the effector organ. This would be present like this. Sometimes the ganglion might even be embedded within the effector organ, right? So they're always very close to the effector organ, right? So from the intermediate lateral horn, this is going to go a long way like this, right? So in parasympathetic system, it goes a long way in the preganglionic fibers, and after that from the ganglion, the post-ganglionic fibers go relatively short distance, right? So this is a post, right? That is pretty easy. And when you come to the sympathetic system, it won't be like this, right? What you have to understand is that in sympathetic system, there are two sets of ganglions, the paravertebral and prevertebral. There are collateral ganglions that are present, right? So just take a look at this. You can see that there is a spinal cord, right? Just next to spinal cord, we have what is called the sympathetic chain, which are a set of ganglia which are like connected together, right? So these form the sympathetic chain. So these are para, next to the vertebra, paravertebral, right? And apart from that, in front of the vertebra, prevertebral, right? So this is the vertebra, in front of the vertebra, right? In the stomach, abdomen, there are lot of ganglia which are present, right? So there is a celiac ganglion, superior mesenteric, inferior mesenteric, aeticorenal, right? So all these different types of ganglia which are present, all right? Yes. So in sympathetic system, what you have to understand is that this is basically going to come out through basically ventral root. Even this is going to come out through the ventral root, and all the impulses coming into the spinal cord always comes through dorsal root. Whatever's going outside will always go through the ventral root, Bell-Magenti law, right? So whatever's coming from here, consider this is a sympathetic, right? We already seen that we have chains of ganglia over here, sympathetic ganglia which are there, corresponding to each vertebral segment, right? So consider this as one vertebral segment, say T1, right? Or because we've also included parasympathetic, I just make it as S1. Okay. So consider this is one vertebral segment, right? So each vertebral segment has its own sympathetic ganglia next to it, and this is an effector, right? So what do you see over here? There are fibers which are going like this, right? So this basically goes and becomes your motor root, whichever it is. Some nerve which is going to some motor segment, right? When we say it is T1, T1 has a corresponding segment in the body which it represents, where sensory fibers come from, right? Dermatomes, and motor system goes. So that will go to that part, right? The T1 corresponding dermatome or even the myotome. So the sympathetic fibers, right? These are somatic, right? The sympathetic fibers will come out from this now, reach your ganglion, right? So compared to the parasympathetic system, what happened? The pre-ganglionic fibers are shorter here, and from here they are going to synapse, and different ways are there for this to go on. One way it can go on is it can go back through this and go to that dermatome, where it is going to supply the skin, blood vessels of the skin, right, and sweat glands, right? So these become what is called the pseudomotor, right? So this is longer, it has to go to the skin, right? So the only difference here is these are special group of fibers that are coming. They are sympathetic system, but their post-ganglionic segment is releasing acetylcholine. So they are cholinergic. Okay, so these are cholinergic sympathetic. So I had mentioned already how it goes to the sweat glands, it goes to the skin, it goes to the blood vessels surrounding the skin. So that is your sympathetic cholinergic system. Okay, so these are paravertebral ganglions. Right? Now apart from this, we have another set of ganglions that I had mentioned, the prevertebral. Right? So imagine there is a prevertebral ganglion here. Right? So another thing that can happen here is it doesn't synapse over here. Right? It's called a pre-ganglion, post-ganglion till the point it synapses at a ganglion. Right? If it does not synapse at a ganglion, say this fiber is coming like this, right? Coming here, it does not synapse, and then it goes to your next segment, the paravertebral. So sorry, the next segment, which is the prevertebral. Right? So then from there they synapse and then they form the next postganglion, which goes to different parts. So what do you understand from here? The sympathetic system is not so rigid in its structure. The preganglion can be very close, as in the paravertebral ganglions. It can synapse there and go to its own dermatome. Or it can go without synapsing at the paravertebral, right, and go to some prevertebral or collateral ganglion and synapse there and then go. It can also from here go synapse here, right, and from there go to different places. For example, T1 to T4 it forms the cardiac plexus, right? So instead of going to the skin dermatome, it can go into the viscera where it will supply to different things, right? So there are three things that are happening here. Either it can be very close to it and then go to the viscera, or it can be very close and then go to its long post-ganglionic and reach the skin, sweat glands, right? They form the pseudomotor, the cholinergic. Or they can not synapse over here and form a longer preganglionic segment and reach a prevertebral segment and go. Okay, so the point here is sympathetic system varies, right? The preganglionic segment can be long, it can be short, right? And the postganglionic is never as short as the parasympathetic system. It's not that close. It always has to traverse some amount of distance, right? But when we take a parasympathetic system, the preganglion is always longer and postganglion will be very short because the ganglion is always close to the effector or even embedded in the effector tissue, right? And we already know that preganglionic is myelinated B type. Postganglionic is unmyelinated C type. For both of these. So again, when we talk about the sympathetic and the parasympathetic system, there is always a center where it begins, right? And it reaches a ganglion and it finally goes to the effector. And this fiber from this whatever is forming, that will go through the pre-ganglionic fibers, and that is going to release neurotransmitter, which is going to be picked up from the post-ganglionic, and these are post-ganglionic fibers which finally release neurotransmitter to the effector, right? So we already seen the difference about which is longer, which is shorter, what type of nerve fiber this is, what type of nerve fiber this is. Alright, okay. Now the thing is understanding what neurotransmitters are released and what is happening. Okay, so what you have to understand is this from the center to the ganglion, whether it is sympathetic system or parasympathetic system, ultimately it is always acetylcholine which is released. Right? So just understand that. Over here, Acetylcholine is the main thing that is released. There are other neurotransmitters which are also co-released along with that, but the main thing is acetylcholine. Right? Many other peptides are also co-released over here. Okay, so the first thing is acetylcholine. So the pre-ganglionic fibers always release acetylcholine, and the post-ganglionic fibers are now modified based on whether it is a sympathetic system or a parasympathetic system. Right? If it is a parasympathetic system, a similar acetylcholine is released. Right? And if it is a sympathetic system, this has been modified to release things like norepinephrine. Alright, so this is one thing you need to understand. From these nerve terminals, that is the post-ganglionic nerve terminals, it is norepinephrine that is predominantly released. Norepinephrine, not epinephrine. When the affected tissue, I told you a lot of affected tissue are there, right? One among those affected tissue is your adrenal medulla, right? But that is kind of a little different. I told you how the pre-ganglionic in sympathetic system varies. Sometimes it synapses at the paravertebral segment and goes. So basically the pre-ganglionic segment is short. But there are instances where it does not synapse at the paravertebral ganglion. Instead, it goes to some collateral ganglion or prevertebral ganglion. Right? So one tissue, which is your adrenal medulla, is kind of similar to that. It kind of acts like a ganglion. Right? So this will go from here. It will not synapse anywhere. Right? It goes through the chain ganglion. It does not synapse there, right? It goes to the aortico-renal ganglion. It does not synapse there, and it finally reaches the medulla, right? There it's going to now synapse. So where is the post-ganglionic over there? It starts from the medulla. So basically that is very short. It directly releases. There's no fiber as such over there. The medulla directly releases different things, right? So that is epinephrine and norepinephrine. Alright, so the concept you need to understand here is that the nerve terminals, the post-ganglionic nerve terminals, are always releasing norepinephrine, not epinephrine. Epinephrine is only released when the medulla is stimulated. So this will happen in case of stress. Right? Some stress is there and that activates the medulla to release epinephrine and norepinephrine. But when we take a look at the heart, I told you about the cardiac plexus T1 to T4. Right? So those that synapse here and then go to the heart. Right? So what is released at the heart? Not epinephrine. It is released. The norepinephrine is released, not epinephrine. Understood later, because of stress, if we exercise, say for example, along with this, the stress will also release these things and that is going to act on the heart. Understood? So these are all various small things that can be modified and made into question. One thing is pre-ganglionic, post-ganglionic segment. What type of fiber it is? This is myelinated B type. This is unmyelinated C type. Whether it is short or long. Right? We already discussed that. Next thing is about the sympathetic systems. Norepinephrine is released at the post-synaptic or post-ganglionic segment. Right? Epinephrine is predominantly released from the medulla. Right? In the ganglion level, every time it is mostly the acetylcholine. Right? Apart from acetylcholine, few peptides are also co-released along with it. Right? And the post-ganglionic segment, this is what is important. What has been modified to either release acetylcholine, or if it is sympathetic system, it releases norepinephrine. Well, another set of questions that I've seen from autonomic system, I've seen the options in various MCQs, so I'll just cover that as well, so that you understand the basics of that when you're answering questions. Okay, so that is about the higher control, right? We saw till the pre-ganglionic fiber, right? Where the neuron begins, right? Intermediate lateral horn in the sympathetic nervous system. In parasympathetic nervous system, there's a craniosacral outflow. Intermediate lateral horn in the sacral segment, and in the cranial segment, we have the different nucleus, right? So, but what about things above that? Is anything controlling it beyond it? Are there higher controls, right? Like we had seen the upper motor neuron in your somatic system, like that. Are there any higher controls? So yes, the answer is yes, right? So this is a center, so there is higher control beyond that, right? So one of the major higher control is your hypothalamus. So in the hypothalamus, especially the paraventricular. So apart from that, below that, you have your pons, right? So in the pons, you have pontine A5 nucleus. Below that, medulla is also there, right? So over there in the medulla, the ventrolateral medulla. So these two are there, the rostral and the caudal. You might have heard of this when you talk about the baroreceptors, right? So in the baroreceptors, you know that the rostral ventrolateral medulla is controlling your sympathetic activity, right? So that is how heart rate, everything changes according to your baroreceptors, right? So that is there. Also, we have the dorsal raphe. So all of these are going to exert your control over this center. Alright? So, question, is hypothalamus the highest controlling center? No. Because beyond hypothalamus, we have your limbic system. Right? So parts of the limbic system like amygdala exerts control over this. Right? And finally, results in modulation of your autonomic activity. Yeah, so there are a group of sets of things, right? Often termed as central autonomic network, right? The limbic system versus the hypothalamus, right? The periaqueductal gray, the striatum, these parts. So there is a group of cells, right? So a group of regions in the brain which commonly together are referred to as the central autonomic network, which exerts a higher control over your autonomic nervous system. Okay, so just take a look at this diagram. It's a diagram from Ganongs, and you can see the same thing. How there is a hypothalamus, the medulla, the pons, right, and how they are exerting their control over the pre-ganglionic segment.